Love hurts, but did you know you can actually die from a broken heart? It's called broken heart syndrome, and it's on the rise. Joining us via Zoom to explain more is cardiologist Dr. Tiffany Sizemore. Welcome back to the show, Tiffany. How are you?
Thanks, I'm great. How are you?
All right, I'm going to learn something here. What exactly is broken heart syndrome?
So, broken heart syndrome in the world of cardiology, we refer to it as a stress cardiomyopathy. And essentially what it is it's an emotional response from a cardiology standpoint. And so what happens is people have this crazy emotional response to something. Usually it's a sudden death or a divorce in a relationship. And what happens is it affects the heart's ability to contract. The problem is that patients present to the hospital with the exact symptoms of a heart attack. Exactly. They're having chest pain, they have EKG abnormalities, they have cardiac enzyme leakage in their bloodstream. And so we have to end up taking these patients to the cardiac catheterization lab, and then we find out, well, all of their arteries are clean. And so what's going on? And then we look back and they tell us, oh, my husband left me, or oh, someone passed away. And this was only diagnosed in 1990, originally in Japan, actually. And so we're seeing more and more numbers come up with this stress cardiomyopathy or broken heart syndrome, figuratively and literally.
So it's definitely on the rise, you're saying?
Definitely on the rise. The American Heart Association, the Journal of the American Heart Association, actually just came out with some research showing that there's been 135,000 cases over the past 10 years. And they kind of drilled that down and said, well, who's getting this? And most of the time, they're actually older women. Like over 85, almost 90% of the time, it's an older woman. And we're not exactly sure why. We do know that women typically have more anxiety and depression diagnoses. And we do know that those typically go hand in hand when it comes to this broken heart syndrome.
All right, Doc, what is the difference between a heart attack and broken heart syndrome? How do you make that differential diagnosis?
The difference is patients with a stress cardiomyopathy or broken heart syndrome actually have completely clean vessels most of the time. And so we take them to the cath lab and then we do the cardiac cath and we say all the vessels are clean, what's going on? But the heart takes on this very interesting shape. And so it's kind of ballooned out at the bottom and squeezed in the middle. And it's shaped just like a Japanese pot, called a takotsubo pot. And so in Japanese, it's called a takotsubo cardiomyopathy. That's what they catch octopus in Japan.
Wow. All right. It's all about prevention, Dr. Sizemore. What can we do to prevent this condition?
I tell all of my patients in my office, regardless of what their diagnoses are, you have to control your stress levels. Because if we can control our stress levels, we can control some of our hormones that make our blood pressure higher, make coronary disease worse. So I talk about meditation with almost all of my patients. Almost everybody should be meditating on a daily basis. And then kind of checking in with themselves emotionally to see what they can do to kind of control it. Because when it comes to a stress cardiomyopathy, broken heart syndrome, besides stress management, there's really nothing you can do.
All right. For our viewers out there, though, if you do have chest pains and shortness of breath, don't disregard it as being stressed out or saddened by an event. It's extremely important to get to an emergency room as soon as possible. Broken heart syndrome is not something you can self-diagnose yourself. You need an expert like Dr. Sizemore.